to our webinar on MSc Podiatric Medicine. My name is Lucy Heaney. I work here at the International Office here at University of Galway. Today I am joined by the Programme Director, Amanda Walsh, Fiona Lowry, Terence Ayrott, Denise Healy, and I see Sarah, our international graduate there. Sarah is joining us as well. Thank you very much for joining us all. On the right-hand side, I see there's already a few messages there, so thank you very much. You are welcome to ask any questions you might have throughout the webinar, but we'll hold back to the end of the presentation to answer questions. So in the meantime, I'll just hand over to you, Amanda, now for your presentation. Thank you.
Thank you, Lucy, and welcome everybody to our webinar. So I'm going to be talking to you about the MSc Podiatric Medicine pre-registration, or essentially graduate entry program. So I'm going to take you through some of the aspects of the program, what it entails, what the application process. So hopefully it will inspire some applications onto the program for the incoming intake in 25-26. So with regards to the program, what is podiatric medicine? So for those of you that may be not familiar with podiatric medicine, we are a specialised kind of health profession and we're dedicated really to the diagnosis, treatment and prevention of problems within the lower limb and foot. So we're classed as autonomous practitioners in the fact that we're able to assess and diagnose problems within our scope of practice as podiatrists within the lower limb and foot. And I'll talk to you a little bit about the scope in a second. So this is quite unique, I suppose, in the medical field in the fact that we are specialists in the lower limb and foot, and we work alongside lots of different health professionals treating a variety of different foot and lower limb problems in relation to diabetes, pediatrics, vascular problems, biomechanical, musculoskeletal problems. So we're kind of uniquely placed within the medical profession to specialise within that area of the lower limb and foot. The program itself is designed for people who have a non-podiatry degree, so it is a graduate entry. So we are looking for individuals who want to, I suppose, transition into a career into podiatry and become a podiatrist as a profession. So it's appealing to healthcare and other professionals, and we kind of state in our application process about having a cognate degree. So we require a level 8 degree to be able to come onto the program. This is pitched at a level 9 in MSc. So it's not a traditional kind of follow-on MSc program. So it is a graduate entry program for those that don't hold a non-podiatry degree. So we say about cognate degrees, so we're looking for people who have experience and a degree in different healthcare and other aspects that have transferable skills into a field of podiatric medicine, or if someone wants to transition and change career and become a podiatrist. So it is a 2 calendar year program, so different to other programs in the fact that it's not an academic year, it's 2 calendar years. So the first year is over 3 semesters. So the program consists of 3 semesters. So semester 1 will be September to December, semester 2 is January to May, and then May through to August is the semester 3, where the clinical rotations occur within this program. So it is a 2 calendar year program, and obviously fast tracking people into the profession in comparison to the traditional undergraduate BSc program, which is a 4-year program. So we're really trying to create a versatile pathway into the profession and into the field of podiatric medicine and podiatry. And as a pre-registration course, it obviously trains you to a level 9. So you obviously come out with a threshold level qualification in podiatry to be able to, in Ireland, register with CORU, the regulatory body, and we are looking for accreditation of the programme from the Royal College of Podiatry, which is the UK professional body, and Podiatry Ireland, which is the regulatory body here in Ireland. So it allows an opportunity for individuals once graduated to work in lots of different aspects of podiatry, and I'll talk to you a little bit about that in a couple of slides. So why podiatry in the University of Galway? We're uniquely positioned in the fact that we're the only university to offer podiatric medicine in the Republic of Ireland. So that puts us uniquely positioned within the university and the University of Galway itself to be embedded within the College of Medicine, Nursing and Health Sciences. That allows opportunities for our students to have interprofessional learning alongside occupational therapists, speech and language therapists, nursing students, social work, and other disciplines within the college itself. We also have the opportunity of having input from other disciplines within the program. So we have a strength to the program in the fact that we have a very established Bachelor of Science degree, so an undergraduate 4-year program to which we have mapped and developed this 2-year calendar year MSc graduate entry program. So we have input from the likes of anatomy, pharmacology, physiology, and clinical medicine within the College of Medicine, Nursing and Health Sciences. So we really have those integrated links within different professions within the college and the wider university. As I said, we have an established program, an undergraduate program, and now we are rolling out, we have the first cohort undertaking the MSc, so the graduate entry program. So we have an established teaching team with a wealth of knowledge and skills to be able to support the training, clinical training, the academic training, the knowledge and the theory of our MSc students. We have a state-of-the-art clinical facility which supports our clinical placements. So we have a clinical team who support clinical supervision, as well as our academic team who facilitate supervision of our students in a clinical setting also. We have collaborations internationally with research, and that's a real strength with regards to developing the evidence-based practice to which we work from as podiatrists in the clinical field. One of the other strengths to the programme here at the University of Galway is that we have small numbers. So even in our undergraduate programme, our numbers are approximately around the 40 mark in a year cohort. The postgraduate programme, so the MSc, the graduate entry, we're looking at a cohort of 15 per year group. So relatively small numbers in comparison to other disciplines. So we get to know our students on a one-to-one basis. We supervise on a one-to-one basis in a clinical setting. So that's a real strength to the learning of the program and how students progress through the program and transition through the years and obviously graduate and then go on into the working field. So what can podiatric medicine offer you? As a podiatrist, we specialise in the lower limb and foot, which is a real, I suppose, advantage. That was one of the things that brought me into the profession, is the fact that it's quite specialised. So we are kind of doctors who specialise in the actual lower limb and foot. So it is a chance to work as part of a multidisciplinary team. So we offer specialist knowledge in the area and the scope of practice of podiatry. We are able to, I suppose, confidently manage, diagnose, assess and manage different problems within the lower limb and foot, really to improve people's quality of life overall. It is a very practical and hands-on career, so not every pair of feet are the same and not every patient that comes through the door has the same condition. So it can be quite challenging, it's varied. So we're obviously put to test with regards to being able to assess and diagnose problems and then put a management plan in place for the patients that come through our door. So what's the scope of practice? So with regards to the qualification that you get if you study podiatric medicine in the graduate entry program, it doesn't qualify you as a doctor, so it's not a doctorate, but what we are practitioners that are able to specialize in these areas. So I've listed some of the areas of specialization. So as a podiatrist, you are a professional, a profession that manages lower limb and foot problems. So it's a regulated profession. And some of the areas that of scope of practice that we do train and we do work within. So on the left-hand side there, we've got the musculoskeletal aspects of the biomechanics. So we might be assessing a patient that comes through with a sports injury, or it might be that they have heel pain or foot pain in a general region, and we have to do a biomechanical or musculoskeletal assessment to determine what's happening. So if it's the way that the patient's walking, if it's the structure or the function of the foot that's causing a pathology, it's our job to be able to determine what's happening. And in the sports field, looking into kind of sports injuries within the lower limb and foot and how we can manage those, maybe related to foot function or related to pressure and forces going through the foot and through specific structures that might cause patients problems. Podiatrics is an aspect where we deal with children. So we assess and diagnose problems in the pediatric population. So this might be toe walkers, in-tone walkers, it might be children with flat feet, it might be some child with Down syndrome or cerebral palsy that has complexities around gait and functioning and structure and function of the foot. So that might involve advice and developmental milestone checks, and it might involve things like orthotic management and developing orthotics and prescribing orthotics to be able to help the children being able to maintain their activity and do all the things that we want them to continue to do with children. The middle strand there is a high risk strand, and this is an area that podiatrists work in quite predominantly in the public sector and in hospital settings. So you might well hear of podiatrists working with patients with diabetes or patients that maybe have vascular problems. And what I mean by that is that they may have circulation problems that means that their vascular status is compromised, which puts their feet at risk of things like ulceration, and certainly a lot in the press around diabetes and amputation. So one of our roles as a podiatrist is to try and prevent lower limb and foot amputation by the management of some of these more high-risk conditions. So that's the stream of vascular complications, patients with diabetes that may have complications as a result of that condition, which then leads into kind of the wound care aspect. So a lot of our role is managing wound care and ulceration and being able to manage them if they present, but also try and avoid them developing in the first place. A lot of preventative care as well. The other strand there in the middle is rheumatology. So we have a podiatrists who may want to specialise or work more in the remit of rheumatology or rheumatological problems. So things like osteoarthritis, psoriatic arthritis, rheumatoid arthritis cause major deformities and problems within the feet that need managing on a multidisciplinary level. So you'd be working with rheumatologists, to help to manage some of these conditions. But we'd obviously be focusing on structural deformity and managing conditions that present within the lower limb and foot. On the right hand side there we have minor surgery. So as a graduate of the podiatric medicine program, both undergraduate and the MSc, we train students in local anaesthetics and injection therapy to be able to do minor surgery. So this is toenail surgery essentially. So the partial or full removal of toenails under the administration of local anaesthetics. The foot and ankle surgery is a kind of a postgrad, so you have to go on to do foot and ankle surgery, and there are some podiatrists that have gone on to do postgrad study and become podiatric surgeons. There's a whole different program that focuses on that, but that is something that can be advanced onto if surgery is an interest to people, but it isn't part of the MSc or the undergraduate program. The minor surgery is, and the local anaesthetic therapy. So I suppose podiatry in general with regard to that scope of practice is really exciting and rewarding. So we get lots of different types of patients coming through our clinics. And the type of work, it might be dressing an ulcer, it might be manufacturing orthoses, it might be assessing a child that's tiptoe walking that we have to make sure that the developmental milestones are appropriate. It might be assessing an elite athlete with regards to a sports injury. So the skills that a podiatrist has is very varied. And we work in different environments, but we also work alongside a lot of different health professionals. So we work alongside consultants, endocrinologists, general practitioners, nurses, physiotherapists, orthotists for some of the more complex cases, and we work in different settings like private and public practice, in hospitals, in community outreach kind of centres. Podiatrists can work primarily in research, they can go into education, sports clubs, footwear companies. So the whole aspect of working in different settings that can come along with the profession of being a podiatrist. So the curriculum itself, so just to give you an overview of the curriculum with regards to the MSc and the 2 calendar year programme, this is the overview of the first year of the programme. So these are all core modules, and all modules have to be passed in order to progress to the second year of the programme. So the first year really is focused around some of the core skills and core knowledge with the grounding of becoming a podiatrist. So we acknowledge that people coming onto the MSc program will have skills and knowledge from previous careers and obviously previous qualifications. So we assess that once people come onto the program with regards to any recognition of prior learning. So that's something that we would assess on an individual basis. So the podiatric medicine practice module, so you'll see this in both first year and second year. So this is one of the larger modules that is the clinical module. So this spans over the 3 semesters, and this is where the clinical hours are contained with regards to the clinical practice and the clinical placements. The professional practice and healthcare leadership is around research, but also kind of professional skills. So just building those professional skills in relation to podiatry. And again, we acknowledge that people will be coming in with different set of skills and transferable skills, but it's really relating it to the profession of podiatry. And the same with some of the other modules as well. So human body structure, gross anatomy of the lower limb, and human body function. So the human body structure is an anatomy module. Gross anatomy of the lower limb, again, is an anatomy module, but focused on the lower limb and foot. Human body function is a physiology module. So again, the groundings of physiology, for those that may have not done physiology, it may be a refresher for some people. Applied physiology is an endocrinology and an advancement of the physiology module that occurs in semester 1. So really, again, putting the groundings in place for the core skills and knowledge that's required to then go into clinical practice. The human motion and biomechanics is around functional anatomy and biomechanics and lower limb kinematics. So this is really looking at normal structure and function and moving into then looking at how pathologies present and how the mechanics of those pathologies, the etiological factors and how they develop. Now, the integumentary system is a combination of podiatric dermatology, so the skin and nail pathologies that present in podiatry, as well as the groundings of looking at wound care and more of the high risk side of patient management. So again, these modules are very tailored towards podiatry, but have the general sense around the anatomy and physiology. So this is the structure of year 1, I suppose, just to give you an overview of the 3 semesters. So there are modules that take place primarily in semester 1 and then drop off in semester 2. The majority of them will span over semester 1 and semester 2 due to the content. And then the Podiatric Medicine Practice 1 goes over the 3 semesters, and the third semester is primarily an 11-week clinical block at our Merlin Park facility here in Galway. So the 11-week block allows students to progress through the clinical skills very competently over the summer period. This is the year 2. So the second year of the program looks at, these are the modules. So again, the Podiatric Medicine Practice 2 module is one of the larger modules, the clinical module, where students undergo rotations through various different clinic types, like a pediatric clinic, vascular clinic, diabetes clinic, and musculoskeletal clinics. So they rotate through different clinics to get the experience which supports the academic knowledge within the modules that they learn and have learnt in the year 1 of the programme. The research dissertation allows students to be able to apply research skills into the programme, and that's started in year 1 as kind of the groundings of research design, and then students are then afforded the opportunity to do the research dissertation. The lifestyle and clinical medicine is really around some of the clinical medicine and surgery topics that we would cover and the conditions that we would cover in more complex high-risk patients. There's a pharmacology module, so this is around kind of the pharmacological management of some of the conditions that we would see, and specifically around local anaesthetics and the indications for use, and how as podiatrists we use local anaesthetics and other medications to manage patients, linking in with endocrinology and our GP colleagues with regards to some of the pharmacological management, a real understanding of how kind of pharmacological management can have an impact on our patients and then have an impact on how we manage our patients as podiatrists. Musculoskeletal medicine across the lifespan is one element of that is the sports musculoskeletal medicine, and the other element of that is the pediatrics element. So really kind of looking at musculoskeletal aspects of growth and development in pediatrics, but then in adulthood, how injury cares and what types of injuries occur and how we can manage them. And then the professional practice and healthcare leadership practice 2 is a module where we look at working within a public sector. So there's 2 elements to this module. It's around working with vulnerable adults, an aspect of how we holistically manage our patients, and looking at how we work within a public sector. So here within Ireland, it's the Health Services Executive, the HSE. So how we work within the HSE and the role of a podiatrist within the public sector, but also how we might want to work in a private practice. So really kind of giving knowledge and background to if someone wanted to set up private practice, what skills would they require to do that? So preparing our students for lots of different aspects of opportunities after graduation. So at the bottom picture there is our Merlin Park facility. So right in the middle of that is our Unit 3, which is the podiatry clinic. So it's a 20-chair clinic, and there's a surgical unit on there as well. So basically we have 1,000 clinical hours of required hours over the 2-year program. So students have to meet the minimum 1,000 hours to be able to graduate, and that's a requirement of the program from a registration point of view. So we have that dedicated clinical facility at Merlin Park, and we also have multidisciplinary placements as well in vascular and orthopedics and in voluntary sectors as well. So this is our clinic, just to give you a few screenshots. We have a biomechanics lab, the picture on the right-hand side there. We also have the surgery unit, which is the top left picture. So that was built on a few years ago, that allows us to complete our minor surgery procedures. But it's also shared with our colleagues from plastics who do procedures as well in our unit. So it's a dedicated facility, a fantastic facility that students really enjoy having that clinical experience. We have a clinical team that support the students' clinical placements, and we have academic members of staff that support those placements as well. So it's a real kind of combined effort from the clinical and academic team to be able to give students the experience and skills and knowledge that they require through the different aspects of the programme. So what are the opportunities after graduation as a podiatrist? So this was an audit that we did a few years ago now based on the BSc, so the undergraduate programme, and this is purely based on graduates and in the Irish setting. But a lot of our students have actually gone international, and we do have international students on our undergraduate, and we're going to hear from 2 of our previous graduates today on the webinar. And their experience of coming through the programme. So there's lots of different opportunities to work in different aspects and different settings, as I mentioned earlier. So, there's a very established and successful career pathway for podiatry practitioners, both here in Ireland, in the UK, and internationally. So when you're qualified as a podiatrist, you can work in lots of different areas, and you can work in lots of different countries. So in Ireland, the HSE is the public health system, but there's also podiatrists working in footwear, orthotic companies, sports clubs, going into education, going into postgraduate study and research, working abroad, but also in private practice as well. So what are the course entry requirements? So internationally, we require the IELTS. So we do require a level of English to be able to come onto the programme. So that's outlined on the left-hand side of the screen. We are focusing this on obviously mature learners that already have a level 8 degree, so a non-podiatry level 8 degree, so equivalent to a University of Galway minimum 2-1 degree in a cognate discipline. So when we say a cognate degree, we've got examples of things like biomedical engineering or human biology, clinical sciences like the biology, physiology, anatomy, other health and social care professions like social work, physiotherapy. This is not kind of a limited or limited list. We appreciate that people will have experience and have qualifications in areas that are very transferable into the profession in podiatry. So the process that we go through with regard to the application process is that once documents are uploaded with regard to the application, which is on the left-hand side of the screen, what's required, we screen the applications and invite applicants in for an interview. And I think it's really, I suppose, an advantage for us to be able to to get to know our applicants and see what experience and knowledge people have of the profession and why they want to come onto the programme, and what previous skills and knowledge that they have that they can transfer into the programme and into a career in podiatry. So we do offer an interview, and that's for us to get to know our applicants, and then there's level 2 screening beyond that to be able to then determine suitability for appointment onto the programme. So this is one of our current students on the MSc programme. So this is Rachel, and Rachel has a background. She completed her undergraduate, so her BSc in sports and exercise science, and then she went on to do a Master of Arts in Health Promotion. So Rachel's come onto the programme as she wanted to pursue a career in podiatry. And I can let you read those on the left-hand side, but she's really enjoying the programme, and she's recently just been nominated for a Student of the Year. So the Flexitol Tomorrow's Podiatry Awards, which is UK and Ireland. So all students studying on undergrad and postgrad programmes, this is opened to people to nominate, and she was nominated. And she has been shortlisted for Student of the Year pre-registration from here in Galway. So fingers crossed for Rachel that she's awarded that. But Rachel really loves the course. You can see on the left-hand side there, she said that it's challenging, but the modules are interesting. She's acknowledged that the lecturers are supportive and helpful, and we try to offer that, and we try to promote kind of a supportive environment for our students. Students really love the clinical and the practical sessions, and this is something that Rachel acknowledges with regards to the clinical skills lab and the clinical placement preparation. What is she enjoying the most? The practical elements, and that's generally what we find with students. So once they start to get into patient contact, which the MSc students are just going to start to do now, so very kind of early on in semester 2 of the first year of the programme, they are starting to go on to clinic and treat patients before their full 11-week block over the summer. So we try to transition the student through the programme in a very logical way with regards to the academic content, and then building them into the clinical skills. What advice would you give? Obviously watch the webinar, so thank you all for coming online. Try and shadow a podiatrist if you can. If you're not really sure what podiatry is about, that's a good bit of advice, just to see what the scope is. It's not always what you think. People often think that podiatry is just around kind of cutting toenails and treating corns. It's much more complex than that, and there's much more involved in it, much more kind of rewarding and exciting career opportunities that people maybe don't realise. So yeah, Rachel is on the programme at the moment, and we have other students with different backgrounds. So we have students with maybe a nursing background. There is a few more with sports and exercise science as a background. We have a social worker on the course. So there's lots of people on the programme at the moment with different skills and coming from different backgrounds, which I think really complements the cohort and allows for progression, a real nice progression through the programme. So why Galway, I suppose? These are a few pictures of our lovely city here in Galway. So the university was founded in 1845, and we sit right in the heart of the city. So it's a real hub of activity when students are on campus. So it's really nice when we get back into semester time, when the students are around the city and around the campus. The campus is spread up along the river, so we have lots of nice areas for students to sit out. The city is always active with regards to different cultural activities going on, and there's always something happening at different times of the year. So students really embrace the cultural aspects of Galway and what it can offer with regards to social activities and networking and those types of things. So that's enough from me. I know that we have Terence coming on to talk to you a little bit around kind of the international supports. But this, I suppose, I'll pop this up again at the end of the presentation. But this is just how you find out more. So if you had any specific questions that you maybe think about after today, these are our contact details, and the course webpage is a really useful source or resource with regards to details of the programme. But if you wanted to get in contact, then you can take those details down and email us directly, and we can link in with you if there's any specific questions. But I'm going to hand over to Terence now to talk to you from his experience and around international coordination and some of the supports available to students.
Hello. Oh, there we go. Lovely. Yes. Hello. So my name is Terence Rocht. I'm the international coordinator here in the School of Health Sciences. So we have our two past students there, Jumana and Sarah, with our, I suppose now there was a change of roles, but the head of the school, Caroline McIntosh, here in podiatry. And just want to say again, thanks so much, guys, for coming to help us out. Next slide, please. Okay, sorry, it's a bit text heavy. I was aware of that, but I was thinking it might be a useful resource as well, because they're just more kind of information. And as well, I was aware that there's probably a lot of domestic Irish students here as well as international students. So firstly, yeah, I think it's good that we have our own international coordinator here, myself, specifically within the School of Health Sciences. So my role is to act as I suppose initially as you can get in contact with me from the very beginning, even if it's through to the point of admissions. If you have any queries, if I can't help, I'll be able to act as liaison between yourself and someone who can help effectively. And then so throughout the year as well, I would hope everyone would feel welcome enough to approach me if there's any issues or you need resources, and I'll go through some of them that again I can kind of help point you in the direction, but also kind of try where possible set up some social gatherings and networking as well to try and build a community within the school. So I think that's important, to highlight that, there's not only the wonderful academic staff that you should feel welcoming and safe to approach, but also myself, if you want to kind of step out of that, and we take it from there. There's also the international office, which you probably will be in contact directly or indirectly initially, but they are a very accessible, really friendly support network there as well, where you can ring them, you can walk in to, they have a new building near our school just across the road, so you can go in and talk and ask for help or anything or information, and they as well, in terms of any visa or immigration issues, they would be the more current, up-to-date kind of resource there. But if I can again help in any way, you can ask me, and if not, I could direct you there. As a bigger, in terms of the campus, I know Amanda touched on the college itself, but just to really emphasize how we are kind of a compact, smaller city that I won't say humble, but it's friendly. It's we're on the river. You'll see a river. We go all along that, and it leads you right up into the heart of the city. So from we're the kind of the other end of the campus, the north end of the campus, but it's still only about a 10-minute walk, and you're in the, I don't know, some of you might say hard to say the city, the Galway, but it's because it's small, but the city centre anyway. Then if we're talking about transport, we have there's bus systems. There is a bus station where you can get inter-county to travel anywhere around the country. There's a pretty good system in action there, and there is direct buses as well, if anyone's flying to Dublin city itself or Dublin airport. And then there's also a local bus service to navigate through the city or the suburban local areas, and a train again. So there's no, if you're not used to Galway, there's no train service for within Galway itself per se, but it's more for inter-county if you want to travel outside of Galway. And like that, if sometimes, especially when there's first years are coming in, I try and get everyone together, and some maybe students in other classes or years, and they will help with questions, or if I can ask even about things like that, about, you know, how do I use the bus services? Is there a card, one for all, and all that can be used? I think it's important then as well to emphasize the clubs and societies. Some facts there. I don't know, I probably won't bore you reading through them all, but there is 47 sports clubs currently, so indoor, outdoor, lots to try. And I always recommend it, whether you're domestic or international, to try and embed yourself within the culture and the society of both the university, but, you know, you will then, by byproduct of that, become part of the Galway society as well, and the societies as well. Even if you think you're a bit more of an introvert, there's probably an introvert society for you. You know, if you're, you know, there's something for everyone effectively in the societies as well. So I think it's really important to immerse yourself equally, well, not as equally, I mean, go to your classes, do your studying, but it's an important part of the university life, and I'm sure the Sarah or Jumana can talk about that. And there's also lots of sports facilities, indoor and outdoor. There's a gym and a 25-meter pool, and lots of sports grounds for soccer, GAA, and water facilities as well, because we're obviously in Galway Bay, but also by the river, and there's rowing clubs and so on there. Could you go to the next slide, please? Thank you. So this, I suppose, is more potentially relevant, or you could say important initially, but also to domestic students as well, about, obviously, accommodation is something obviously you'll need to look into. So there is on-campus accommodation villages available. So there's Carb Village, Goldcrest Village, and a newer one, Dunlin Village as well. And they're located actually our end of the university, so we're situated close to there. Now, I will have to flag that, yes, you know, accommodation is a challenge, but obviously we'll try and help with that if possible. And if basically to start looking into it as soon as you make the decision to apply for the course, if possible. And then there's other options off campus. If you know, for whatever reason, you might want to look in the local area at renting a room from either a family or a private landlord, or maybe joining a house share. So we find sometimes people have communities already that they might be able to access outside of the, I suppose, the network that you're entering into in the university. And just part of that, there is a website set up that's very useful, Student Pad. And guys, you can actually use this prior to getting your university email address, which is very useful. So you can log into that and have a look for private off-campus accommodation. And it also gives you details about what facilities that's near, or transport options and so forth. And then, as you see there, accommodation advisory service, well, they're there to advise or help you effectively to get accommodation, and again, very friendly, and they've a lot of resources. So if you have an idea of what you might want, whether you want to try and get on campus if possible, or if not, or you know, they'll tell you what you're eligible for, or they also have a contacts of private student accommodation as well, if you want to rent off campus but student accommodation. And then we have kind of more I suppose services as well, supportive, such as counselling. So there is qualified experienced counsellors, as it says there, psychologists, psychotherapists. So these are all confidential and free of charge, you know, especially if you're coming in from, you know, another country, a new culture and everything. Things can be overwhelming, or not. Maybe you're a domestic student, just the change of life, you know, it's there anyway as an additional support if anyone feels they need it. And there's also a university creche located just up the road from our building at ours, Myola here. And there's just some details there from 6 months to 12 years. And that they have apparently a new garden growing project, which they link into the menu. So that sounds exciting. Visas. So again, primarily through the international office. The thing that I'm kind of approached more often about is the IRP, the Irish Residence Permit. If you're coming from another country, which you effectively is a card to say you're allowed to stay here if it's more than 90 days. Now the rules are kind of fluctuating. Sorry, and fluctuating mean changing. And there's a new regulation only come into effect last November, where the very first time you need to do this, you are going to have to go to the Dublin office, unfortunately, in person to get the card. But after that, you're able to renew it online. Okay, so there's kind of like a negative and a positive. So once you get the card, though, you can do it all online, and it hopefully will run smoothly then. And there's also a student health unit. So hopefully you won't need to visit this, but it is there. There is one on campus with doctors there. And also, I don't know, did Amanda just state, you might need vaccinations and immunizations as part of the course for the clinical elements, and you might be able to go there. Do they use the student health service, Amanda, directly, or is that just if there's issues?
No, so students register on the program because the vaccinations are part of the requirements of the program. So once a student enters the program, then they register with the student health unit to be able to then access those and book in to have those vaccinations done as a healthcare practitioner, which is the same as the medical students within the College of Medicine. So the student health unit also provides our occupational health kind of service. So if any students are struggling, then the occupational health, they can have an occupational health review with the student health unit. So they're really our primary unit with regards to students accessing the services that require with regards to the immunisations, and then any kind of occupational health reviews. But in general as well, that it's there for students with regards to kind of GP access within the time that they're here as a student as well.
Okay, great, thanks. And there's the disability support service. So I think as well, it's there again if you have anything that could be classed as a disability. So they described it as ongoing physical or mental health conditions, or learning difficulties, or it could be literacy issues. And it's always important to flag this as early as possible, because maybe you might have some kind of accommodations, maybe without losing marks, for example, if you need an extra bit of time to work on assignments and so forth. And then the application deadline now, in terms of as a generalization for international students, it's usually May 1st, but there's probably usually a bit of leniency there. Could you clarify that actually, Amanda, about the general application date, or would you know off the top of your head of that? Sorry, putting you on the spot here, Amanda. Sorry.
No, you're okay. I think it's up on the website. I'm not actually sure what the closing date is, to be fair. But all details are on the website, so that will be updated. Brilliant, with regards to the closing date for those applications.
Okay, yeah. Thanks. Okay, that was kind of it. Unless someone if you want to ask any specific questions, you can put it in the chat. And I just realized, a lot of text in the slides. Sorry, I should have put some images, because we did have, for example, like a Halloween evening for international students, where we got together and watched a horror film and had some treats. Very exciting. Okay, so that's me done. So thank you very much. There you go.
Perfect. So over to Sarah and Jumana now. I believe you have a presentation here for us.
Hi everyone, this is Sarah. I'm a podiatrist who graduated from University of Galway 2021. And we're here today, me and Jumana, to share our experience of how was it for us to be international students in Ireland, specifically Galway.
Yeah, hello everyone. It's a pleasure for us to be here with you today. Actually, from KSA to Ireland, we are from Saudi Arabia, and this is by itself is a big difference to transfer from Saudi to Ireland, and this was a big challenge to us. but we managed to finish the course. We enjoyed it. It was a really good journey, and we liked it in there, and we lived a very, very good experience. Regarding the culture, there is a lot of different cultural experience. We had a lot of new friends in there. We had experienced the weather, which was a big change from our country. We had also living like in an open country like Ireland. It was really amazing for us. In regard to, can we move to the next slide, please? The facility, everything that we need, we found it in the university. Everything that we wanted, it was there. You just need to ask if you have anything that you need, like accommodation, visa, orientation. It was all available for us. So in the first week, I remember everything was established and scheduled for us, going through the Cultural Bureau processing and finance issues and accommodation. All of that was set out from we arrived in there. Also, there is, I remember the accommodation. It was a little bit challenging for us to find accommodation, but make sure to arrive earlier before the course is starting in order to find a good place. And also all other supports like gym, crash, as we mentioned before, it's all available, and it was lovely. Actually, it was lovely experience. Can we move? Regarding the place, for us as international, we have a lot of facilities in there. There is the mosques, there is international for food-wise, halal food is available. Entertainment places, it was available for us, and most of the places are within walking distance, so we didn't really need to use a lot of transportation. We were walking everywhere. For me, my accommodation was very close by to the university, and it was the same to the city center, to the beach, to a lot of places. So we didn't struggle a lot. Yeah, it was a good opportunity. In general, it was a good experience for us.
Let me add to that, if you don't mind, guys. So for everything that we needed, everything was available. The first thing you need to do once you arrive, or even before you arrive, you need to plan things ahead. So you need to put in mind what things that might be challenging. So once you meet in college with those in the international office, you can ask them the questions that you need. Then they will provide it with all, like even with if you have difficulties with accommodation, as we mentioned earlier, if you drop that in, there are other students who might want someone to be with them in an accommodation who have availabilities, or some people who might share an apartment off campus or whatever, and they can connect you to everyone. They take you step by step into making you very comfortable to be like, they help you to sit well and be like, not worried about anything else but you're studying and enjoying your experience. So everything we needed was there. They guided us through the services within the campus and outside the campus. Everything was there. So please, everyone, if you have any questions, or if you want to come, just ask the question, just like put the questions down and then drop them off to them, and they will help you to sort it all. So now I'll be talking about opportunities for us as podiatrists. Since I graduated in 2021, actually there are so many. Everyone will be contacting you for something, because people from the UK have been sending me like if I would like to work there, and I have some actually offers from Ireland too. Other than that, I was contacted by people in Qatar, which is one in the Middle East, one country in the Middle East, and in Saudi Arabia. I have many opportunities. Yes, it starts because they don't know what is podiatry. Not everyone is familiar with the concept of podiatrists or what podiatrists do. There'll be a bit of questioning, but there was a lot. I'm working now in 2 different hospitals with our private hospitals, but one is more like a private clinic, but within a hospital setting. So they are more focused on the diabetic foot. So you can work in hospitals, whether private or public. You can work in private practice, maybe for MSK, specialized in and for athletes and so on, or maybe for those who are interested more in, let's say, a skin routine care and maybe some daily redresses for patients with diabetes and so on. You can also work in cooperative role. I mean, in companies like the ones for pharmaceutical companies, or the ones that provide products for wound management, or let's say for orthotics and so on. I'm actually now working with one of the companies who was established recently, or many years actually, in Saudi Arabia for orthotics. So yes, you can be a full-timer or a part-timer in a hospital and a part-timer somewhere else. So you can grab all the opportunities, try whatever you find yourself in, and then you can stick in that and then develop yourself to what the thing that you like. You can also work in research. So a lot of the work, maybe in Saudi Arabia, it's different, because what we do there, it's more like there is a lot of job opportunities for us. We lack podiatrists. Actually, they hire podiatrists from abroad because we really lack them. So we have everything. Everyone would be asking for us to be working everywhere, and we can't be everywhere. Saudi Arabia is big, huge. So they would be like, oh, I need someone to help us in research, but like, you're not really available here or there, because they want to establish something where podiatry role is involved. So they need a database on what are the needs, because each country have their own data. Like in Saudi Arabia, the most prevalent thing is diabetes, but let's go to Europe. They have rheumatoid arthritis more than diabetic patients. So it varies from place to another. So the need of the country, it's different. So we need to know what is the need of podiatry, or what are actually the needs of for the public health. What do they need? Services regarding health. So we can also work on research. We can work also with sports or athletes, I mean, where we can, let's say, manage their foot problems, regarding exercises, so on, because a lot of them would have injuries and then they would come to us. Actually, I've met in a couple months ago, is it 2 months ago mostly, I met maybe 5 or 6 tennis players, international tennis players, in my clinic, and they were all just like, they were looking for podiatrists, and my name just popped up, and I was in Riyadh, so I was available, so everyone just coming to my place, and they all have problems with their feet, and I was like, yeah, that's me, I'm popular because I'm a podiatrist. I'm just joking. It's not about being popular. It's about like what service I can provide, and knowing that you can provide such a service. It gives you like it's a card. It's like a power card that you have. It's just something that, yes, you provide a service, you know what's going on, and you know how to fix it. And those people need you there. So these opportunities are amazing. And also there are, you can also work in non-profit organization. Actually, me and Jumana now and others, we just established Diabetic Foot Association in Saudi Arabia, the first Diabetic Foot Association, with other doctors here in Saudi Arabia. There is, they're all like, there's the leader is one who is actually a podiatrist. I mean, what do you call them? The one who's the manager. I don't know what they say the word. I just lose it. Anyways, he's a podiatrist who graduated from the UK, and then the chairman, and also we have a podiatrist who have graduated from the but he's a podiatric surgeon who did his degree in the US, and there is us podiatrists, again, 2 of us from Galway, and there's others from different specialities. Yes, we need this to help the public health. They need us there. Our role is important. And it's not only about our role. We are there to practice it all. So what is our scope of practice? It was mentioned earlier, we can do it all. Yet, we need to put this thing in mind that the scope of practice varies from place to another. So let's say if I want to continue to become a surgeon, if I become a podiatric surgeon, I can't practice podiatric surgery in Saudi Arabia unless the hospital give me that, they allow me to practice it within the hospital, but it has to be through different regulations. So don't think that if you do this, or if you continue this path, that you'll be able to do whatever anywhere. You need to know exactly what is the plan and what is the regulations in your country, so you can practice it full. We are hoping that this will change in the future, so because it has to be an option, especially with the fact that to become an orthopedic foot and ankle orthopedic surgeon, it takes so many years, but there is a lot of people who require surgeries like tendon, like for example releasing or whatever, and these are like minor ones that can be conducted in the clinical setting. These if it's doable, then we need to get more privilege toward them. But as I said earlier, the scope, it's huge. You can do a lot with podiatry, and believe me, at first I was so confused when I say podiatry. I actually each year I ask my mentor each year, like from first year, second year, third year, each year I'll be going to my mentor, I'll be like, what can I do? Like, can I do this? Can I do that? How can I help in Saudi Arabia? And I remember me asking Caroline, my coach, and even asking Amanda herself about like, oh, but what if I go home? What if they don't know what is podiatry? No one knows what is podiatry. Doctors don't know what is podiatry. I remember me asking the same questions over and over. But now the first year, yes, was difficult because it's different here, very different. They expect you to do a lot. And what I believe that was done greatly in University of Galway is that we were independent learners. They give you everything, but they teach you how to go through it. So it's not like you just absorbing these information and put them back into paper. It's not about that at all. If this is the way you think you're gonna go through college and become a good podiatrist, that's not the course that you want to be in. You gonna learn it right. You gonna go through it hard. You're gonna learn things in different ways, many different ways, but the ways that gonna help you to be more capable of doing or practicing podiatry. And when you practice it, you put your own print into it. That's it for me.
Thank you so much. Wow, that was so much information from both of you. Thank you so much. I had questions, but I think you answered all of them there. Now we have some questions from our viewers. I am tempted to ask about the international tennis players, but I'll leave that for another time. Let me see. I think Brian asked a question about the opportunities of working in places like Canada and Australia. Amanda, I'm not sure. Let's try and see them here. Fiona's answered all of the questions, but I think there might be just some that will be of interest to our viewers who are watching the recording of this.
Yes, I know that Brian asked about the typical contact hours as well with regards to the program, and that's something that we do get asked quite a lot. So this is certainly not a part-time program. It's a 2 calendar year program, and now our current first years of the MSc this year are currently in 4 days a week. So we do try and protect 1 day, but it's not always possible because we have input from different disciplines like anatomy and physiology, pharmacology. We sometimes have little flexibility around when we can schedule lectures. So they're generally in for roughly around 15 to 20 hours with clinical hours. So this semester, like this semester 2, MSc students are on clinic all day on a Friday, and then they have various other academic lectures throughout the week. So it works out about 4 days a week. Now that varies per semester. So last semester, again, it was a 4-day week. They didn't have clinical rotations, but they certainly had preclinical skills training, which is a substantial amount of time. So that's kind of, it's certainly not part-time. It's certainly not online or remote learning. We do expect students to be on campus because of the skills element of the training that's required for the program. So we get asked a lot if it can be online, or if it's remote learning. It certainly isn't. Our students are they're hands-on doing clinical skills, clinical training, in treating patients, doing kind of flipped classrooms, in for tutorials. So it is very much kind of hands-on. But those are the general kind of hours, Brian, with regards to that.
Great, thank you. Is the course recognised in Australia and Canada?
This differs. So we have had students, we have had graduates go to Australia to work. Some countries require an entry exam. So dependent on their professional bodies and their regulatory bodies. So obviously our regulatory body here in Ireland is CORU. Each regulatory body in different countries can have a different set of requirements as to what a podiatrist coming into the country has to do to be able to get registered. Some have an entry exam, some it's just an acknowledgement of this of the program that they've trained and whether that's recognised in that country. So it does vary, and if you want to work in a specific country after graduation, it's best just kind of checking that out, because they do vary slightly as to what the requirements are dependent on the regulatory body that regulates the podiatry profession in that country.
Wonderful. I think you may have answered this, but Marianne just wanted to know, is there a summer break for a few weeks?
So we do incorporate breaks. So we've been very conscious that it is a very intensive program over 2 calendar years. So students have built-in breaks between the semesters. So we certainly build in the breaks between semester 1 and semester 2. We have a break between semester 2 and 3 before their clinical block, and then they have a break before their exams after that third. So we do build in. It isn't the same as the undergrads where they have the whole summer off, but we do build in the breaks between the academic semesters for the program, because we are very conscious that it is 3 semesters. It's a calendar year, so we have built in those breaks for students, and our current MSc students have found that really useful. And they are quite satisfied and happy with the breaks that we've incorporated. So that seems to be working well with regards to the scheduling of those breaks in between the semester times.
Okay, and I know we're running out of time, but Marianne just wanted to know, is dermatology a part of a module on the programme?
It certainly is. So we have a module in the first year of the program, Podiatric Dermatology, which is part of the integramentary system. So it's a unit as part of that module. So that focuses around podiatric kind of dermatological conditions, so specific to the profession. But dermatology is carried through in our clinical modules. So when we see patients on clinic, we're very kind of cognizant of identifying dermatological. So we have dermatoscopes, we have links into the hospital to refer people into the dermatology department. So dermatology, I mean, we're looking at people's skin, we're looking at people's nails. You know, it's a big part of what we do. So it certainly is incorporated into the clinical modules as part of one of the modules specifically around podiatric dermatology. Yeah.
Perfect. Thank you. I think, Fiona, thank you so much, Fiona. I think you've answered so many of the questions there. It's been really, really helpful. Thank you so much for everyone for joining us, from Amanda and Terence for their presentations, particularly to our 2 graduates, Sarah and Jemana, and Denise there in the background as well. And hi, Fiona, again, good to see you. Thanks so much for answering all those questions, and for everybody who asked us all those questions again. It was really good to have so much company this afternoon. Thank you very much. Take care. Bye-bye.